Well, good afternoon, good morning, good evening, whenever you're good day. Good day. My name is Jody Scholes, and I am your instructor for the MBLEx review course. So welcome. Welcome to the next phase of your adventure in becoming a licensed massage therapist. I am delighted that you are here today because you are sending a clear message to yourself, to those people who love you, family, friends. Uh, by setting this time aside, you are sending a clear message to the universe that you are ready to pass that test, to pass the MBLEx. Yes. So by setting this time aside, you're making it a priority. You're making yourself a priority, and you're making this adventure, this next phase of your life. Hey, whether that goes quickly or that goes slowly, there's no right or wrong here, honestly. But just by hearing the sound of my voice, that means that you are sending that message out to the universe, to the God of your understanding, to the vibratory field, to the collective consciousness, that you are going to work as a licensed massage therapist. And I say work, but some people who are graduates of school intend to have this as a hobby or a part-time gig. Others intend to work full-time. Both are beautiful. When I entered massage school, I thought I was going to be working just on family and friends. And turns out that here I am 29 years later. Yeah. And it's been a full-time profession for me, not only doing the work, which I still am a licensed massage therapist in 3 states, and seeing about 10 clients a week. Yeah, because I love the work. Yeah, it's awesome work. And it's also really awesome to be supporting you in this part of your journey. Yeah. After I sold my full-time practice, my larger clinic, I moved very organically into teaching at the Northern Virginia Community College massage therapy program. Um, and so adjunct faculty, supervising the clinic, I loved teaching. And so today I get to blend both of those talents, both of those gifts. So doing the work and teaching the work. However, you don't get to do the work unless you get to pass the test. So let's get to that. And in the very first part of class, I like to talk about test taking strategies, how you are going to prepare for the MBLEx. In part 2 of the class, we do our learning. And today we're talking about pathologies, some very specific pathologies. So pathologies are basically, you could consider them complaints, concerns. When your client comes in and they have a concern, that could be a pathology. Yeah. So it's a dysfunction of the body. A pathology is a disease or a dysfunction of the body or something that your client has a symptom. So something they can tell is going wrong or not going the way they want it. Yeah. And then in part 3 of class today, we're going to dissect some questions. And we dissect the questions because we're going to need to bring that strategy into the Pearson VUE Testing Center. You're going to need to know how to dissect questions to be successful at this test. Maybe you are a big brain and you just have all this information in your head. Lickety split, you get the questions done. Normally not. Many of you have taken that test before, and you know, I mean, I think you'd agree with me that when I took the MBLEx, you could have told me I got every question wrong. You could have told me I got every question right. For real. It's just that kind of test. And so we need a strategy. That's why we learn in part 3 of class to dissect questions. But let's get started with the first part of class. So in part 1, we talk about test taking strategies. And today, I want to encourage you to consider the type of homework that you do. And my strategy I want to share with you today is to do meaningful homework. Look, I can't imagine being out of school like you are right now, or maybe finishing school, and having this pile of information, 12 different systems of the body, 7 different categories of the MBLEx. It's a mountain. It's a mountain of information to study. And so, how do we study? How do we do meaningful homework? What does that actually mean? Well, that means having a strategy to your homework. And the strategy I recommend is that you look at the 7 categories of the MBLEx and you tackle one per week. 7 categories, 7 weeks. And then in the 8th week, you take some practice exams. Now, you can take a practice exam whenever you want. ABMP has practice exams, AMTA, David Merlino has a great one. I have a great one. Practice exams build your test-taking stamina. So meaningful homework could look, if you studied twice a week, you would be tackling one category of the MBLEx, so let's say anatomy and physiology, and then taking a practice exam. So that's studying 2 days a week, tackling one topic, really digging down with your inventory of anatomy and physiology, systems of the body. And the Federation of State Massage Therapy Boards has a list of what's on the MBLEx. It's called the content outline. In fact, I'll attach it here. I'll attach a link and I'll attach it in our patron community for you to take a look at if you haven't seen it. 7 categories, 7 weeks. Very systematic. So 7 categories, but 1 content and then 1 practice exam. Now, you may be wondering, where do I see a practice exam? I've given you the locations. Our patrons, many of them are at the $5, $10, $20 tier. If you're at the $10 tier per month, the $10 pledge per month, you get the practice exams. At the $20 pledge per month, you get all of the full-length classes, 7 classes, 7 categories of the MBLEx. So that's one way to do meaningful homework. So however you decide to implement your strategy, have a strategy. Because sometimes we only have like an hour once a week. Let's make that meaningful, right? We've got this idea, okay, I'm going to pass the MBLEx this month. Maybe, if you've got a run and start, you may be passing that MBLEx this month. But if you're feeling a little rusty, give yourself about 8 weeks. Give yourself about 8 weeks. And if you've been out of school for a while, maybe give yourself 12 weeks. So look at the calendar and look at 12 weeks from today. So that would be 3 months from today. And if we were doing that in this class today it's May, the month of May. And so we would say May, June, July. So in 3 months, to have a date to take that MBLEx. I know, kind of scary to think about, right? But that is my challenge to you. Put yourself on the hot seat. Nothing. So I used to do, I used to race. I used to do triathlons. And sometimes it was hard to be motivated to do my workouts, right? But I'll tell you, there's nothing like a race on the calendar to motivate me to do my workouts. So here we are in May. And if I had a race in July, I know exactly what I need to do to get ready for that race in July. Otherwise, I'm going to suffer, right? For those of you who have done a 5K, a 10K, a marathon, you don't just jump out of bed one day and go, oh, I'm going to go do that marathon. You got to build up to it, right? So that's the same thing with the MBLEx. We kind of have an idea, this lofty idea of, oh, maybe I can take this month. Well, you also have to budget for it. And so the MBLEx is currently $265. And so we want to make that worth it, right? We want to make it worth our time, our money to take the MBLEx. So we do meaningful homework. And my challenge to you, 3 months. Sometime in the next 3 months, May, June, July. By the end of July, you do your math. If it's not May anymore, do your math, okay? May, June, July. By the end of July, prepare yourself to take the MBLEx. Prepare yourself for race day, game day. We'll talk in the future about game day preparation, but that's your game day, man. That's your race day. That's the day. Like, all right, that's fight day, right? If you're a boxer, that would be match day. Can you get ready over the next 12 weeks? I think you can. I think you can. Here's the benefit. You get to take August off. How would that be? You get to take that month off. You now don't have to study anymore. Bonus, right? You can take the month of August off and start work in September. Yeah. You like that idea? I do too. All right. Well, I'm going to come back to that touchstone now and then. Over the next 12 weeks, I'm going to poke you through our patron community. If you're a part of our patron community, and this is going to go out to the public today, but for you guys who are here right now, you're a part of the patron community. I'm going to poke you. Meaning I'm going to nudge you along. All right. Part of the way we nudge you along is through our learning. And so in part 2 of class, I get to share with you some pathology. All right. You ready for some pathology? Let's do it. All right. Let me get us out of the way. Ooh, hello, back up. All right. I think we'll do better over here today. Very good. So here's our pathology for massage therapists, what you need to know. There's a lot of pathology out there. I'm going to talk to you about what you need to know to practice safely and pass the test. So we'll be defining pathology as it relates to massage. We're also going to be trying to get us out of the way. There we go. We're going to be talking about a bunch of different pathologies. There's about 10 or 12 I like to cover. I think we're going to get through probably 5 today. The full-length classes on pathology, the full-length class on pathology, that will cover all of the different pathologies. And also in the patron community, type in the search box, type in pathology. All of our pathology lessons are tagged, and those will come up. So if you want to dig down deeper on pathology, go to the patron site, go to our lessons, our videos, type in pathology and see all of the videos that come up. I think there's 5 or 6. All right. Today we're also going to be talking about common symptoms in these pathologies, and then giving you the basis for when these questions come up on a quiz, and the quiz in the online learning center, when you're taking quizzes, maybe from other apps that you have on your phone, or on the MBLEx, that you're going to feel comfortable, you're going to feel confident, you're going to understand what these pathologies are talking about. Today we're going to talk about tendon disorders, tennis elbow, golfer's elbow, Achilles tendonitis, whiplash, We're not going to do sprains or strains today. It takes too long. We're going to talk about carpal tunnel syndrome, postural deviations, and if we have time, thoracic outlet syndrome. All right. Tendon disorders. What the heck is a tendon disorder? Well, what is a tendon? A tendon attaches a muscle to a bone. What attaches a bone to a bone? You can put it in the chat. What attaches a bone to a bone? Not bone on bone. But if a tendon attaches a muscle to a bone, what attaches a bone to a bone? Oh, got some answers. Boom, boom, boom. Yes, good job. Wow, we got to get fast. Good. JL, nice. Jay. Kiara, yes. Gloria, yes. Amber, yes. That is right. Ligaments attach bones to bones. So they were going to talk about tendon disorders, muscles to bones. So we're going to talk about Achilles tendonitis, tennis elbow, also called lateral epicondylitis, golfer's elbow, called medial epicondylitis. All right, let's start with Achilles tendonitis. So put your hand on your Achilles if you're not driving or operating heavy machinery or out, I don't know, doing surgery. Put your hand on your Achilles. Where is it? Yes, very good. Your Achilles is located just above your heel. So in the back, it's the Achilles tendon attaches to the calcaneus. So technically the Achilles tendon is on the distal end of your soleus. So that it's the distal end of the muscle that is your soleus. So here you see a soleus. Actually, is that? I want you to see the soleus. There we go. There's the soleus. The soleus is actually under the gastroc. So here's the gastrocnemius, right? Also sometimes called the gastroc. And so we have the lateral head and the medial head. So that's that heart-shaped muscle, right? The muscle that's nice and round. It's what people usually refer to as their calf muscle. But a part of the calf muscle, you have the gastrocnemius and you have the soleus. And the soleus is under the gastroc. And so you see here, if we peel away the gastrocnemius, here's the lovely soleus. And the soleus turns into the Achilles. The Achilles tendon is what attaches the soleus to the heel bone. Did I already say the name of the heel bone? If I did, I'm going to ask you again. What's the name of the heel bone? What's the name of the heel bone? All right, because that's where the Achilles tendon attaches. See some answers. Ooh, Gloria, on point here, Gloria. Oh, okay. Add a little hint here in the image. Let's see. Yes, good, Kira. Yes, it's the calcaneus. Very good. So that heel bone is called the calcaneus. The Achilles tendon comes down, and you'll see here's the calcaneus, and it attaches here. And technically, it attaches on both sides, the medial and the lateral side of the calcaneal bone, the calcaneus. And so, oh, this is nice. So I want to just point out here that in treatment, it's important when we have someone who comes in presenting with Achilles tendonitis, so we're learning that this, I-T-I-S, itis, arthritis, bursitis, tendonitis. Itis means swelling, inflammation. Actually means inflammation. So I want you to be aware that that almost every muscle has a reciprocal, what's called a reciprocal muscle group. So a front and a back, basically. And so we know we can identify that really easily when we talk about like our bicep, right? So we've got a bicep and we have a tricep. In the front of the leg, we have the quadricep. In the back of the leg, we've got the hamstring. All right, those are considered reciprocal muscle groups. And even the soleus, the gastroc, has a reciprocal muscle group. So the gastroc is that heart-shaped muscle. The soleus has a reciprocal muscle group, and it's in the front of the leg, the front of the lower leg. Please, I tell you this to encourage you to massage the front of the lower leg. It is so yummy, so yummy. And right here is a common area. So on the tibialis anterior, but also remember the tibialis posterior. Now, if you're sitting down, you can cross your legs, put your ankle, your lateral ankle bone, your lateral malleolus, put that on your knee or on your quad. So you make a +4 type of, you can see this, +4, right? So ankle, it makes kind of a 4. All that's like kind of sitting in a +4 position. So when sitting in this +4 position, you can actually access your own posterior tibialis. Taking your thumbs, wrap your fingers around your shin, and press behind your shin. That's where you find the posterior tibialis. This is a very important muscle to treat when you're treating Achilles tendonitis. That muscle is almost always sore. Is it sore on you? I find it sore on a lot of people. So let's just remember to work the lower leg. Achilles tendonitis is inflammation of the Achilles tendon. Treatment for it, just so you know, is not only treating the Achilles, treating the soleus, but also treating both the posterior and the anterior tibialis. So we want to think in terms of reciprocal muscle groups, treating both sides. I will mention that personal trainers, some massage therapists go on to get their personal training certificate, and personal trainers will tell you that if you've got low back pain, it could be from weak abdominal muscles. This is another example of reciprocal muscle groups. Some of you have heard of this, that if you've got a sore low back, it could be because you have weak abs. And, you know, clients of personal trainers will be like, why do I have to strengthen my abs to help my back? Well, think about it. Your abs, your abdominal muscles, are the front of your lower back, right? Another example of reciprocal muscle groups. Okay, let's move away from that. Shake it off, shake it off, shake it off. And feel free to shoot me questions in the chat if you have them. Or to ask me after. Just jot them down so you remember. All right, let's move to another tendon disorder, and that is tennis elbow. So tennis elbow, also called lateral epicondylitis, is an inflammation of the tendon, not the ligament, the tendon in the lateral part of the elbow. Now, here's where our foundational learning becomes important. Is the lateral epicondylitis, the tennis elbow, lateral elbow, is that pinky side or thumb side? Put it in the chat. Pinky side or thumb side? Which is lateral? How do we know? What do you come back to?
The pinky side.
Oh, Ansley, Ansley. Ho, 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 you would think, right? Because that's what it looks like here, right? Stand in anatomical position and tell me what is lateral. So
Laterals away.
lateral is away, so it's on the outsides, right? And when we stand in anatomical positions, our thumbs poke out. And so lateral in this case is the thumb side. So it is here. So that's why it's the extensor muscles. The lateral epicondyle, and that's in anatomical position. I'm like leaning in here. Yep. So tenor's elbow affects the lateral epicondyle. Let's take a look at golfer's elbow. It's the opposite, but let me tell you the truth. If a client comes in and they present, they say they've got tennis elbow or they got a golfer's elbow, they don't know what they're talking about. I love them. They might be right, but over 75% of the time, they say they golf, and so they must have golfer's elbow. Check both sides, the lateral and the medial epicondyle. Epicondyle. So I want to say epicondylitis, but check both sides. Check the medial, lateral. All right, so golfer's elbow affects the medial epicondyle, otherwise known as medial epicondylitis. And so you can see here, the pinky side. And in golf, the thumb is really important. You may or may not know that. But in this case, think about anatomical position. We've got to start all of our directional instructions, or when you see something on the MBLEx that tells you lateral or medial, you must go into anatomical position. That's where all of this direction starts from. Medial, closer to the center line. Lateral, further from the center line. And so you see here, the inflamed tendon is affecting the medial epicondyle. Let me do it this way. They're in anatomical position, right? I am standing in anatomical position. Maybe my arms aren't out so wide. Lateral, farther away from the body. Medial, closer to the body. All right. You get it. So golfer's elbow, usually when we treat it, we use cross-fiber friction and ice. We want to actually break up a little bit of that scar tissue. If it's inflamed, that client can do ice, ibuprofen, NSAID is a non-steroidal anti-inflammatory drug. So like ibuprofen, like Tylenol, not Tylenol, Aleve, those types of things. Oh, here we go. So some treatments to reduce the inflammation are contraindicated with tendinosis. So tendinitis versus tendinosis is the difference between it being acute or chronic. Itis is acute, it just happened. Osis, tendinosis, is a completely different beast. It's thickening of the tendon. It could be sore, it could be a little inflamed, but tendinosis is a thickening of the tendon because it's been injured over time. So in this example, the NSAIDs, the non-steroidal anti-inflammatory drug, is actually contraindicated with tendinosis because it's been documented to inhibit collagen repair. I know that's getting a little detailed for you, but if you get this kind of question, this will be a toughie. So anything that inhibits collagen repair, so when we are repairing a tendon, the body is laying down collagen to build those fibers back up. And in the thickening, in the tendinosis, we actually want that body to repair. So I will leave you with that. It's a little details. There is a difference between tendinitis and tendinosis. That's what you need to know. Itis, inflammation. Tendinosis, thickening of the tendon because of repetitive stress and repeated. So it's almost like it's thickening and scarring. That's osis, tendinosis. I just ask if it's acute or chronic. Acute is it just happened. Chronic is it comes and goes. Like it happens. It's been happening for a long time. It comes and goes, but it's been happening for a long time. Acute just happened. Probably never had it before. All right, let's take a breath. How are we doing on time? We're good. We're good. All right. Whiplash. This is another pathology. So we just went through tendon disorders. Now we're going to look at whiplash. This is another pathology. Why do we care about it? Okay. Well, let's first identify what it is. Whiplash is, you normally hear about it after a rear end car collision, because whiplash is the neck that has a back and forth movement, very rapid, kind of like the cracking of a whip, right? Whiplash. So back and forward. Now, it's not just from a car accident, rear end auto accident, but it also can be a sports injury, getting hit by a soccer ball, being hit if they're playing soccer, a head-to-head collision. So different ways to get whiplash, but a very common way is through a rear end car collision. So if you see a question on the MBLEx that involves the rear end car collision, you know, you got the sniff. Ooh, there could be whiplash there. Ooh. It is contraindicated to do massage within 72 hours of the incident. So if a client comes in and says, ooh, I had a rear ender yesterday, our question is, have you been to the doctor? Have you been cleared by the doctor that there's no major injuries in your cervical spine, in your neck? Oh, yeah. The doctor signed off. I'm fine. I'm actually feeling fine. Great. We proceed with caution. They've seen a doctor. The doctor has signed off. They come in, oh, I had a rear end car accident yesterday. And how many times have you known someone who got into a fender bender, and they're like, no, I feel fine. And then the next day, they're like, oh my gosh, I'm so sore. Why do you think that happens? Did you learn in school why that happens? Ooh, I got answers. Hold on. Thank you. Yes, thumb. Yes, you were right on that. Thank you. Tell me in one word, why are we concerned about whiplash? One or two. Ah, yes, Kiara. Good. Yes, good to, by the way, good to see you, Eva. Good to see you, Amber. Yay, Jay. Thanks, Kiara, Gloria. Yes. But Kiara got to it first. The word is adrenaline. The reason that massage therapy is contraindicated for whiplash for 72 hours is because it could take that long for the adrenaline to leave their system. Adrenaline will also mask any injuries. It'll make you feel just fine. Oh man, no, I'm okay. It's like that, oh, holy crap, what just happened? This is the time where like grandmas lift cars off of grandchildren, right? It gives you extra human strength when you have adrenaline in your system, and it can mask some injuries. That's why it's important to know whether they've been to the doctor or not. If they've been to the doctor, if they've been to the emergency room, you can proceed with caution. If not, you cannot do the session. You cannot work on their neck. You can work on the rest of them, but it's contraindicated to do massage. And we actually probably shouldn't do. Here's the correct answer for the MBLEx. Don't do the massage unless they've been to a doctor because of the adrenaline. They could have a low back injury. They could have whiplash. They could have a joint injury, knee, elbow, shoulder, and they don't know it yet. All right, let's move on from whiplash to talk about another pathology. Do you feel like you're on a merry-go-round of pathologies? Here's a new horse. Woo-hoo-hoo, here we go. Okay. The carpal tunnel syndrome. So this is like TMJ. As massage therapists, as licensed massage therapists, I would like you to use the correct terminology. Would you also like to use the correct terminology? Well, depending on your instructor, you may have heard TMJ. You may have heard carpal tunnel syndrome. TMJ is an anatomical position, anatomical location. Your temporomandibular joint. We all have one. If you can open your mouth, you have a TMJ. You have a temporomandibular joint. We don't all have TMJ syndrome, temporomandibular joint syndrome, or temporomandibular joint disorder. That would be a problem, a pathology in the TMJ. Likewise, we have a carpal tunnel. We don't all have carpal tunnel syndrome. All right. So what is it? Carpal tunnel syndrome is a condition that it causes like tingling throughout the usually the first 3 fingers of the hand. Sometimes 4th and 5th finger, but that's a different beast. That's actually an indication of a cervical issue, the 4th and 5th finger. But typically the first 3, you can feel the tingling, you can feel some pain. There's usually, and it has to do with this carpal tunnel being compressed. So this carpal tunnel, so see there's 8 carpal bones, and you see them here. And they kind of make a little dome. It's almost like a wrist watch band right here, like where you would have your watch. There's a carpal ligament and a carpal tunnel. The bones help to make up that tunnel. So when this ligament, this carpal ligament right here, gets tight, it shortens. By shortening, it compresses the amount of space in that tunnel. And that compresses the nerve that runs through the tunnel. Makes sense, right? So, treatments for carpal tunnel, and understanding this pathology, understanding there's 8 bones, a carpal ligament that looks like a wrist, like a watch band or a little wrist, a little like the band of your watch. So some of the ways you treat this to create more space. The idea with carpal tunnel syndrome or pain in the wrist is to create more space. So how about we do massage therapy on the carpal ligament? You can do cross fiber. You can do with the fiber. Cross fiber is a little bit more effective. Got a couple bony landmarks here. How about massaging this area of the wrist? How about massaging the heel of the hand? Creating some more space in here. It's so good. It's really good. So This will warm the tissue, and when we warm the tissue, guess what happens? We can mechanically stretch that carpal ligament. Some of the exercises that are given, for carpal tunnel syndrome, let me show you the proper way. And what are they doing? Hands in neutral. Try this on yourself. They are stretching that carpal ligament, right? You can sometimes feel a stretch all the way up your forearm. Yeah, very effective. Some doctors will put a wrist brace on, and that will eliminate the repetitive motion. It will calm down the inflammation by restricting the movement at night. It'll put that hand into a position where hopefully that ligament will relax. But typically it's typing or other activities, repetitive stress, that causes this ligament to shorten. In fact, on my mouse pad, you can see, maybe better that way. See, it's got a little wrist brace. That's to avoid this being in an overstretched position for too long. So other ways you can treat carpal tunnel, you can modify what you're doing that's causing it. You can have a little pad like that I showed you in front of your computer to raise your wrists. So you type more like this than like this. And different doctors will recommend a cortisone shot. They'll recommend surgery. But surgery, if you were wearing a watch and that strap was too tight, what would you do? Loosen the watch, right? Yeah. You wouldn't cut your watch off, right? Probably not. You would just loosen the strap. You'd make it wider. And that's what we look to do with massage therapy for carpal tunnel syndrome, is we look to stretch, to soften, to warm up that carpal ligament, to allow for more space in the carpal tunnel. All right. Let's move on because we got some questions to dissect, but we're not there yet. The next horsey on this merry-go-round today of pathology is called postural deviations. Okay, postural what? Yeah, so posture. Check out your own posture right now. Can you imagine a string on the top of your head? Bringing your just more erect, better posture. Think about where you are. Are your shoulders back? Are your shoulder blades down? Think about tucking those shoulder blades down, rolling those shoulders back. Chin neutral. String on the top of your head, lifting you ever so slightly. That's good posture. Postural deviations are when there's been a deviation from good posture or from healthy posture. So here are some examples. What is postural deviation? So we say this is ideal. It's a good posture. It's something that supports good spine health. We have a little bit of a sway back here. That would be a anterior tilt to the pelvis. Is that what that is? I don't like these arrows. So basically the sway back, you see this little pelvic, it looks like it's tipping anterior. So that sway back, I think of a sway back as like kind of the butt sticking out. We've got the military back, straight, 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 all the way straight here. Same with a flat back. We've got the kyphotic curve. Have you heard of the term kyphotic curve? So kyphotic curve is one we're going to look at more specifically. It's that postural deviation right here in the mid-spine. So mid-spine. Ah, yes, exactly. The kyphosis. What is the mid-spine called? We have 3 sections of the spine, right? Neck, mid-back, low back. What's the anatomical name of the mid-back? Uh-huh. Yay, Gloria. Yay, Kiara. Yes, Lauren. Exactly. It's the thoracic region. So I say that because you'll see this on the MBLEx. The thoracic region, blah, 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 right? And you're like, oh, you know this. We just don't talk like this every day. We don't talk like this to our clients. We talk about mid-back. We talk about the neck. We don't say, oh, we might say your cervicals or blah, blah, blah. Your cervicals feel tight. Meh. Probably not, though. We use common terms with our clients. Yes, Lauren, breakfast, lunch, and dinner. So we've talked about this in the past as breakfast at 7 o'clock. It's a way to remember how many vertebrae are in each section of the spine, breakfast, lunch, and dinner. So in that mid spine, lunch, there's 12 thoracic vertebrae. 7, 12, and 5. Yes. All right, let's continue on. And this is an example of a forward head position. So if you drive a lot, use the computer a lot, that kind of forward head position, driving a long distance. So that doesn't have to be a permanent condition, but if your client has done a long drive, they may come in with back pain or neck pain. That forward, think about it yourself when you're working on the computer or when you're driving. Simply take your fingers, push that head back. We all tend to get there. We come a little forward because we live our life right here. So just now and then, push that chin back. It catches us when we're tired, but definitely for your clients after a long drive, they can have that forward head position. Doesn't have to be permanent. It's just a result of repetitive stress. And remember, ideal posture is different for everybody. Where's our kyphotic curve? Oh, maybe I'll see it later. Anyhow, sorry about that. I thought we were going to get a nice picture of a kyphotic curve. We'll see in a minute. All right, last one. Lord have mercy. The Thoracic Outlet Syndrome. You may have heard of it. I want to show you what it is. So Thoracic Outlet Syndrome occurs here. So even though our thoracic spine is 12, has to do with those 12 middle vertebrae, the thoracic outlet is where this nerve bundle comes through, and it's all of the nerves, comes through the brachial plexus, and it is all the nerves and blood vessels that go down our arm, down both arms. So it technically comes between the collarbone and the first rib. Right here is the collarbone, and under the collarbone and between the first rib. Now, when that gets compressed, just like we were talking about with carpal tunnel, when that gets compressed, there's less space. It can slow down circulation, and it can make that numbness and tingling. This thoracic outlet syndrome can actually cause like pain that goes up or pain that goes down, numbness. So that numbness again could be from the carpal tunnel being compressed, but it could be from the thoracic outlet being compressed. Okay, what causes it? There's like 100 things that cause it. Tight muscles, injury. And sometimes doctors don't know why. But again, it's simply, you can see here a closer picture, the nerves are the yellow, the arteries are the red, and the veins are the blue. They all come under that collarbone. between the first rib and the collarbone, clavicle. So in that area, so you know what else can cause it? Rolled shoulders, shoulders that roll inward. If people are getting some numbness, some tingling, let's give them a little openness. Let's do a little work under the clavicle, guys and gals. Here's our sternum. Here's our clavicle. Go ahead and touch under your clavicle. Maybe do a little glide under your clavicle. Under the clavicle, right? So here's above the clavicle. Here's below. To work thoracic outlet syndrome, we would have to work below the clavicle to open up that pec major, a little bit of pec minor. Very careful with your draping, right? Think about if you're going to work this area, how are you going to drape? You're going to secure your drape in this area, guys and gals, because this is an area where we want to have a clear boundary. So if your client is able, take their arm out and over the sheet. Or tuck that sheet in under their arm. So if they're laying with their arms like this, and they don't want to they're not used to the massage yet, go ahead and tuck under their arm on the lateral side. Secure the drape when you do this work. Because it's really nice even to get into that little sternal notch area. And just to see, is it tight? Is it tender? What's going on there? Could be contributing to a thoracic outlet impingement or a thoracic outlet syndrome. Oh Lord, we're going to skip headaches. Are we going to skip headaches? I think we are, because I want to get to your questions. We'll do a quickie. So there's primary and secondary headaches. These, you know about migraines, you know about tension headaches, you know about exercise headaches, what causes the headaches, sometimes alcohol, if either there's too much, sometimes red wine, if people are buying domestic red wine that isn't organic, can have sulfates. Foods, it can be an allergic reaction, poor posture, skipped meals, low blood sugar, stress. Secondary headaches are the headache is coming because of another condition. So somebody has an infection in their sinuses. Somebody's had a concussion. An ear infection can cause a headache. Brain inflammation, encephalitis can cause a headache. Go ahead, review this recording later, and you can see all these different reasons for MSG, overuse of pain medication. Yeah, sometimes even a tight helmet or tight goggles can cause a secondary headache. So let's dissect some questions. All right, I knew it was going to be tight to cover all that stuff, but let's go ahead and dissect some questions. Shake it off, shake it off. Let's take a breath. You may be wondering why I have a picture of cow, because I thought it was a funny picture. And I'm ready to laugh a little. I don't know about you. Moo. All right, let's dissect some questions. How do we do that? We're going to look at the question. We're going to read the question thoroughly. We're going to eliminate 2 wrong answers, 1 to 2 wrong answers if we can. Reread the question, reread the answers, pick the best answer. I'm warning you ahead of time. These are tricky questions. They're meant to be. Every single question. I shouldn't say that. Many, 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 many questions on the MBLEx are tricky. They are written to distract you, to confuse you. Be careful. All right. So tennis elbow affects which area of the body? Oh, we've got some answers in the chat. Some look, huh? Moving forward questions. All right. So that's good. I'll remember that. Tennis elbow affects which area of the body? The arm, the elbow, the medial elbow, the lateral elbow. Oh, you guys are okay. So, tennis elbow affects. Okay, good. You're remembering. Yes. All right. Answer. Yes, Kara. Yes. Yes, Gloria. Yes, Ensley. Yes. iPhone. Queenie. Lauren. Yes, yes, yes. Good. Let's eliminate one wrong answer. Look at the answer we're going to eliminate.
The arm.
Yeah, exactly. Good. Right. We're going to eliminate the arm. But you know what? Technically, if the other three answers were leg, back, and head, well, then the best answer would have been the arm. But we're looking to dig down. See how in these questions we got very specific. The arm, the elbow, what part of the elbow? That's how we get to the best answer. So many of you have already put this in the chat, but the correct answer is the lateral elbow, letter D. Yes, lateral epicondylitis is also called tennis elbow, and it's affecting the lateral, the thumb side, lateral, farthest away from the body in anatomical position. Very good. There were 3 right answers in that question, by the way. It happens sometimes. Carpal tunnel syndrome treatments include all but hand and wrist exercises, massage therapy on the carpal ligament, icing the affected wrist, surgery. Let's read the question again. Carpal tunnel syndrome treatments include all but, you want to eliminate, oh, you guys caught it. Yes, you definitely need to select the best answer, Lauren. Ensley and Gloria are on their game. All right, take a look. Listen to the question again. Carpal tunnel syndrome treatments include all but. The distracting word is but. Let's get rid of one wrong answer, or one answer we know is not correct. Look at what we're going to eliminate. Wait a minute. We're trying to avoid surgery. Why are we eliminating surgery? What? Well, wait, is surgery wrong? No. Surgery is one of the ways to treat carpal tunnel syndrome, and you'll meet clients who have had successful surgeries where now they're no longer in pain. Eliminate hand and wrist exercises. Good. Yes. JL. Yes. All right. Coming to our answer. Carpal tunnel syndrome treatments include all but icing the affected wrist. Yeah. This isn't an itis. It's not inflamed. It's tight. We don't need to ice it. Can icing make it feel better? Because it makes it numb. Yeah. But it's not treating it. So need to actually understand the pathology to know which is the best answer here. Good job. Good job. And yes, hand and wrist exercises, massaging the carpal ligament, surgery, those are all treatments. But icing is not recommended. Some people do, but they're just numbing the area. All right. A kyphotic curve affects what part of the spine? A kyphotic curve. There's one curve that affects the whole spine, actually. Everything else has to compensate. But specifically, when we say kyphosis, what are we talking about? Ooh, here we go. Here we go. Oh, yes, yes, yes. Very good. Gloria, yes. Tanya, yes. JL, yes. Kiara, Jay, Kiara. iPhone, yes. Yes, yes, yes. Let's eliminate one wrong answer. I don't think I eliminated a wrong answer on this. Just went for it. Let's see. Oh, we got one more answer coming in. Coming in hot. Yes, 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 Lauren. Oh, hang on, let's see. Ooh, Ensley, what question you answered? The kyphotic curve affects what part of the spine? Now, I'll tell you, the kyphotic curve actually affects the whole spine, because when one part of the body, like say I have a hyperextension of the cervicals, the lumbar are still going to be affected. So the whole spine has to shift. But specifically, kyphosis it affects the thoracic spine. So that mid spine, the thoracic region, it's that kyphotic curve. I had a picture of that. Wow, there you go. It's a wrap. Great work today. All right, let's go back to this view. So great work today. Excellent job. Yes, yay. So now what we have done, what we did today, was we reviewed some specific pathologies, what the condition actually is, what the names actually are, what the treatments, the best treatments are. We've reviewed anatomical position. We've reviewed the scientific names. We've reviewed some treatment options for all these different pathologies. Excellent work. My goodness, look at you guys. Boom, 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 boom. You are on fire. Can you wait to get your hands on people? You know, honestly, I hope you're actually doing massage right now. Now, you're not allowed to charge for it. You're not allowed to work in a spa or in a commercial setting, but you can practice and you can ask for a donation. You can accept a tip. Yeah. What, 20, 30 bucks? Yeah, Kiara, I wouldn't work, unless you have your license, I wouldn't necessarily work for the chiropractor, but certainly you can work on the chiropractor. There's another great way to kind of introduce yourself to different environments. See if you can work on the staff. Get some feedback. Keep your skills sharp. You can accept a donation. You can accept a tip. Yes. You can get tips. Yes. Oh, good. Excellent. I like it. Very good. Kiara's saying that she can get tips because yeah, this offers massage therapy. So if someone says, do you accept gratuities? Smile, say yes, and nod your head. Thank you. Yes, thank you. Yes, thank you. Yes, thank you. Take the money. People feel gratitude after you give them a massage. Let them appreciate you with a little cabbage, with a little ka-ching. Yeah. And if they don't know much, my clients usually tip me someplace between 20 and 50 bucks. Yeah. And it's good. You just actually really gave of yourself, right? And I just saw a little comment come up that says, everyone wants deep tissue. Yeah. Yeah. Okay. So when it comes to deep tissue, let me get serious. Give 80%. Please hear me. I know you're like me. We're similar. We always want to give 100%, 110%. I did my best. Back off because you'll burn out. Please, 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 80%. 80% effort. If that muscle is not giving, you're all going to move through this stage of your career if you haven't already. I call it the seek and destroy phase, where you can seek out a trigger point and you can kill it. Don't do that. It pisses it off. It makes the muscle, it pisses off the muscle and it annoys the client. Do the work that you know to do. Don't get into a tug of war with a trigger point or a muscle. Do the work you know to do and have confidence that the work that you're doing is going to unravel that muscle over time. It did not take them 1 hour to get into this condition. It may take them more than 1 hour to get out of it. All right, I'm going to sign off with for the recorded, and I'm going to address some of these questions that are coming in. Thank you so much for being here today. Thanks for hanging in there through a thick lesson, through the merry-go-round of pathology. My name is Jody Scholes. I am your instructor for the MBLEx review class. I'll see you again here on Thursdays or in our patron community. You can see the link below, or for those of you who are here, hit me up in our chat in the patron community. I'm very glad to support you in this part of your journey to becoming a licensed massage therapist. See you soon.